Good morning, everyone. Here, Dr. Srinivas Reddy. Today, I'll be talking on the genital tract diseases of females. Among them, the most important genital tract infections like Candidiasis, Trichomoniasis, and Bacterial vaginosis. Vaginosis will be discussed today. Here we have one case scenario. A 25 years old recently married female presents to STD OPD with complaints of intense vulvar itching and scanty thick white discharge. She is on oral contraceptive pills for the last 6 months. Vaginal discharge was collected and sent to the laboratory. Gram staining of this discharge shows pus cells, budding yeast cells, and also pseudohyphae. The culture shows dry yeast colonies. With this case scenario or the case description, we can suspect it would be a case of candidal vaginosis. Now we will see how this candidal vaginosis will present and the causative agent for this particular disease. So, vaginal candidiasis, otherwise called the genital thrush, and also known as genital thrush. This is the most common species causing for this vaginal candidosis or candidiasis or the Candida glabrata and Candida tropicalis. And it's in a sexually transmitted disease, and abnormal sexual practices, and otherwise called the orosexual practices, also will increase the chance of this vaginal candidiasis, because this candida species are common flora of the oral cavity, so there is a possibility. And predisposing factors are the immunosuppressive conditions and also the temporary immunosuppressive conditions like pregnancy due to the increased estrogen levels. It's prone for candidal infections, and steroid therapy, for the long term usage of steroid therapy, and uncontrolled diabetes mellitus and other immunocompromised states are favorable for the development of vaginal candidiasis or candidiasis. And here if you see, this is the morphology of the Candida species, which are oval and oval budding cells. Oval budding cells you can see here. So this is a gram stain smear examination of the Candida species. Manifestations, as I mentioned already in the case scenario, they produces intense vulvar itching and also the irritation and scanty white thick discharge which appears like cheese. It's known as cheesy appearance, and remember, this is odorless, no odor at all, no bad smell or nothing will present. And another thing is the burning sensation at the time of intercourse, which is known as dyspareunia, also present here, and vaginal rash you can see. Here in these photographs you can see the type of discharge, the curdy discharge or cheesy discharge, and here also this is the patches of lesions you can see, and some of the mucosal surfaces of the vagina will show the rash. So this is the appearance of vaginal candidiasis. The specimen to be collected is vaginal discharge, and the few simple tests are there to diagnose this vaginal candidiasis. One is the pH. Take the pH paper and take the estimate the pH. pH usually will be less than 4.5. That means it shows the more acidic pH. And microscopy shows the pus cells, epithelial cells, and the pseudomycelia. So these are all the pseudomycelia. Here you can see the pseudomycelia. Usually the mycelia will have the septa like this. See, this is septa. This is septa, mycelium and septa. But in pseudomycelium you can see like this. Not septa. This is because of the continuous of the continuous formation of mycelium. So it looks like a mycelium, but it's not the real mycelium. This is known as pseudomycelium. This is pseudomycelium, right? And on culture, on SDA, that is Sabro's dextrose agar, produces dry colonies with yeast smell. See, these are all the dry colonies, and if you see the smell, that yeasty smell you will get. And on chrome agar, this is chrome agar. See, this is the chrome agar. On the chrome agar, different species of Candida will show the different colors. See, the Candida albicans shows the light blue in color. Glabrata produces violet colored colonies and Parapsilosis produces pink colored colonies, and Tropicalis produces navy blue colored colonies. So different species of Candida produces different colors on the chrome agar. Then when you grow these organisms on corn meal agar, which is also known as nutritionally deficient agar. In this agar, you can see the chlamydospores. These are chlamydospores. See, these are chlamydospores. So these chlamydospores are produced, chlamydospores. These chlamydospores are produced on the corn meal agar, otherwise called the nutritionally deficient agar. Treatment for this vaginal candidiasis is topical azoles like cotriamazole you can use, and in severe cases we can use fluconazole or itraconazole, oral or in the topical. Oral or also the topical applications can be given. Topical applications, otherwise called ointments, can be given to treat this condition. Female genital tract infection related to that, the case scenario is a 32-year-old female sex worker presents to STD clinic with complaints of malodorous purulent discharge in large quantity. She is giving the history of burning micturition and lower abdominal pain also, and vaginal discharge was sent for microscopic examination, which shows a characteristic motile flagellated forms in the saline wet mount preparation. So this is the case scenario related to this particular disease, that is the trichomoniasis. So this trichomoniasis is a vaginal disease produced by the Trichomonas vaginalis, which is a genital flagellate and comes under the protozoans. It's a protozoa. It is a protozoan, and it's the most common sexually transmitted disease, and its life cycle involves the two important stages. One is flagellated trophozoite, which is the infective form. So this is the flagellated trophozoite, which is the infective form, and amoeboid trophozoite. This is amoeboid trophozoite, and this amoeboid trophozoite is the actively multiplying form. The actively multiplying form of this Trichomonas vaginalis is amoeboid form of the trophozoite, and the infective form is flagellated form. This is flagellated form. And most important point to remember is there is no cystic stage at all. There is no cystic stage in this one, only the trophozoitic stage existing. And nearly 25 to 30% of the females acts as reservoirs without any symptoms. So the asymptomatic females acts as reservoirs, which contributes around 25 to 50%. After an incubation period of 4 days to 4 weeks, otherwise called 4 days to 28 days, the people will suffer with the clinical manifestations. If you see the clinical manifestations of this one, trichomoniasis, there's an acute stage as vulvovaginitis with itching. Vulvovaginitis, vulva and vagina both are involved with itching, and profuse purulent frothy discharge you can see. This is purulent frothy discharge. Frothy discharge, purulent and frothy discharge is produced, and vaginal mucosa will appear like red in color, which otherwise this is strawberry in color. Vaginal mucosa you can see here this red in color, severe red in color. Here also you can see that red color. Here also you can see the red color. See, here entire thing, this is all red in color. And this strawberry appearance of this vaginal mucosa is also known as this is also known as colpitis macularis. This is known as colpitis macularis. And the punctate hemorrhagic spots are also seen on vaginal as well as cervical mucosa. And dysuria will be there, as well as that is painful urination will be there along with abdominal pain. In male, it presents as non-gonococcal urethritis, bit rarely. Chronic infection shows the pruritus and pain during coitus, and scanty mucoid vaginal discharge also present in this particular case. And complicated, this case is complicated as endometritis, infertility, and cervical erosions. And increased risk of transmission of HIV and HSV two also present, because it's responsible for erosions or the rash in the mucosal surfaces through which the either HIV or herpes simplex virus 2 can easily get transmitted. So the most important complications are increased risk of transmission of HIV and HSV 2 along with infertility. Diagnosis, again the vaginal discharge has to be collected, and again if you see the pH will be more than 5. It's of course this pH, increased pH also will be seen in bacterial vaginosis also, but here also it will be present. And this is a bad odor, the discharge will have the bad odor, otherwise called fishy odor, and with when you combine with the 10% KOH, that is called whiff test. This whiff test is positive nearly only 75% of the cases, not all the cases of this what we call trichomoniasis, but 75% of the trichomoniasis cases are positive for whiff test. And of course the antigen detection also can be done by PCR test. And on microscopy of the vaginal discharge, the wet mount shows the trophozoites with fallen leaf motility, trophozoites with fallen leaf motility. Their size ranges from 7 to 20 microns in size, which are pear shaped. Here you can see these are all arrows already showed, but here you can see this fallen leaf. If they are motile, they shows like a fallen leaf. And if you see, these are all the pus cells. These are all pus cells. This is pus cell, but whereas these are the trophozoites with fallen leaf motility and wet mount preparation. And gram staining examination, you can see lot of pus cells, and of course this is epithelial cell. This is epithelial cell, epithelial cells, and also the trophozoites. Direct fluorescent antibody test is best to determine or to detect this particular trophozoites from the clinical specimen. The best treatment is metronidazole or tinidazole, especially the metronidazole for 14 days. You have to give. You have to give for 14 days. This is a bacterial vaginosis. That means some of the bacteria will cause for the vaginal infection of the women, and main reason for this bacterial vaginosis is the alteration of normal flora, normal vaginal flora. If you see here, this is the normal vaginal flora, this is normal, and this is infected vagina. This is infected vagina, infected one. So where you can't see any kind of normal vaginal flora, this is all normal vaginal flora. This is a lot of lactobacilli are present here, and but here they are not present, and is mainly produced by due to the chlamydia and Neisseria infections. That is chlamydia species and Neisseria gonorrhoeae are mainly responsible for this bacterial vaginosis. And most common mode of transmission is the unprotected sexual intercourse. That's the main mode of transmission of this particular infection. And preterm labors also will prone for the bacterial vaginosis, and vaginal douching, and also usage of or misusage of antiseptics in that particular area, which alters the normal vaginal flora and leads to the overgrowth of this particular bacteria. Etiological agents are the Gardnerella vaginalis, which is a gram-negative, non-motile pleomorphic bacilli, and Mobiluncus, they are motile, curved, and gram-variable bacteria. Usually, they are present in the normal vaginal flora. And anaerobes like Peptostreptococci, which is gram-positive cocci, also responsible for this one. And this Mycoplasma hominis, this is spelling mistake. This Mycoplasma hominis is another important organism causing for this bacterial vaginosis. Manifestations: the malodorous, pale green, slightly increased thin vaginal discharge seen on the vaginal wall. See here, this is the pale green color. It's a pale green colored, slightly increased thin vaginal discharge seen on the vaginal wall, and vaginal inflammation not seen. The vaginal inflammation is seen, not seen, but to some extent you can see little inflammation in the around the cervical arch. And when you combine with the 10% KOH, it will give fishy odor. That means whiff test is positive. Here also the whiff test is positive. Positive here also. That's what we have to understand from this one. The vaginal discharge again to be collected, and pH, just like Trichomoniasis, here also the pH will be more than 5. On microscopy you can see the clue cells. What are these clue cells? The infected epithelial cells will be studded with the bacteria. I mean, infected cells, infected vaginal cells studded with bacteria. These are known as clue cells. See, these are the clue cells. These are all clue cells. These are all violet colored one, nothing but the bacteria. And few or no lactobacilli are seen in this particular case. And if you grow this bacteria on the blood agar, they produces tiny hemolytic colonies are produced. The best method to detect this bacteria, moldy tough. This moldy tough is a newer method. It's available for the detection of this particular bacterial vaginosis. And PCR test also can be done to detect 16S ribosomal RNA from the vaginal fluid. Again, the metronidazole to be given 3 times a day for 7 days. Important causative agent, 3 important diseases seen in the female genital tract. Remember, among them, at least one you will get a short note question in the theory examination, because they are very important diseases among the important as well as the commonest diseases among the females. Thank you all.